Have you ever experienced a sharp pain in your knee while playing sports? If so, you may have suffered from an ACL injury. In this video, we'll explore the causes, symptoms, and treatment options for knee ACL injuries. Let's start with some basic anatomy. The knee joint is made up of the femur, thigh bone, tibia, shin bone, and patella kneecap. The ACL, anterior cruciate ligament, is a band of tissue that connects the femur to the tibia and helps to stabilize the knee joint. ACL injuries can occur when the knee is twisted or bent in an unnatural way, causing the ligament to tear or stretch. This can happen during sports activities that involve sudden stops and changes in direction, such as basketball, soccer, or skiing. Women are also at a higher risk of ACL injuries due to differences in body mechanics and hormones. The most common symptom of an ACL injury is sudden and severe pain in the knee, often accompanied by a popping sound. Swelling and bruising may also occur. If you experience these symptoms, it's important to seek medical attention right away. Acute treatment for an ACL injury may involve rest, ice, compression, and elevation, RICE. Pain relievers and anti-inflammatory medications may also be prescribed. In some cases, surgery may be necessary to repair or reconstruct the torn ligament. After acute treatment, physical therapy is a critical part of the recovery process. A physical therapist will work with you to rebuild strength and range of motion in your knee, and to help you regain balance and stability. Exercises may include leg lifts, squats, and lunges, as well as balance and agility drills. It's important to follow your physical therapist's instructions carefully and to be patient with the recovery process. Returning to sports too soon can increase your risk of re-injury. So, when can you return to sports activities after an ACL injury? The answer depends on the severity of your injury and your progress in physical therapy. Your doctor and physical therapist will work with you to develop a personalized plan for returning to sports safely. In general, you should be able to return to sports when you have regained full range of motion, strength, and balance in your knee. Your knee should also be able to withstand the demands of your sport without pain or instability. With the right treatment and rehabilitation, most people are able to return to their favorite sports activities after an ACL injury. If you think you may have suffered an ACL injury, don't wait to seek medical attention. The sooner you get treatment, the better your chances of a full recovery.